Good morning, Alex and friends. I'm Grace. Today is Sunday, June 1st, 2025, and you're listening to Alex's News. The weather in Riverside today will see a high of 87.4 degrees Fahrenheit and a low of 69.1, so be sure to stay hydrated and plan your activities accordingly. Coming up on today's program, we'll delve into the reasons behind growing global alarm surrounding Iran's nuclear advancements and what implications these developments could have on international stability. We'll also examine the significant challenges facing public health in the United States as it confronts unprecedented budget cuts. We'll discuss the potential impact of these reductions on crucial services and community well-being. All this and more as Alex's News continues. Stay with us. We begin this morning with a critical international development as new reports from the International Atomic Energy Agency, the UN nuclear watchdog, paint a concerning picture regarding Iran's nuclear program. For more on this, we turn to our diplomatic reporter, Ethan. Ethan, what is the latest that has come out of the IAEA?
Grace, Iran is truly enriching its nuclear capabilities at a rapid clip. According to confidential IAEA reports obtained around May 31, 2025, Iran has significantly boosted its stockpile of uranium enriched to 60% purity. As of May 17th, this stood at 408.6 kilograms or 900.8 pounds. This is a jump of nearly 50% since February, when the level was 605.8 pounds as specified by the Arizona Daily Star. This alarming increase was highlighted in reporting from Fortune, authored by Stephanie Lichtenstein and the Associated Press, and by the Associated Press on Yahoo News.
That is certainly an alarming jump, Ethan. What does 60% enrichment mean, and how much uranium does Iran now possess that could be used for a nuclear device?
Grace, IAEA Director General Rafael Mariano Grossi has expressed, quote, serious concern, end quote. As Yahoo News and the Arizona Daily Star reported, 60% enriched uranium is just a, quote, short technical step away from weapons-grade levels of 90%, end quote. Grossi stated Iran is now, quote, the only non-nuclear weapon state to produce such material, end quote. The IAEA estimates 42 kilograms, or 92.6 pounds, of 60% enriched uranium is theoretically sufficient for one atomic bomb. Based on this, Grossi warns Iran now possesses enough uranium for, quote, several, end quote, nuclear bombs.
So Iran is making nuclear material that could quickly turn into a grave illness for global security. Beyond the immediate stockpile, has the IAEA raised other flags about Iran's cooperation?
Yes, Grace. In a separate confidential report, the IAEA criticized Iran's, quote, less than satisfactory, end quote, cooperation into undeclared uranium traces found at several sites, including Turkuzabad and Marivan. These led the IAEA to conclude they, quote, were part of an undeclared structured nuclear program carried out by Iran until the early 2000s, end quote, as reported by Yahoo News and the Arizona Daily Star. The IAEA has called on Tehran to, quote, urgently change course, end quote.
Given these serious revelations, what has been the reaction from global powers, particularly the United States and Israel?
Grace, these revelations come at a delicate diplomatic juncture. The U.S. administration under President Donald Trump is actively seeking a deal, though talks have been without agreement, as reported by Yahoo News and the Arizona Daily Star. These indirect talks, mediated by Oman, began around April 12, 2025, as part of a 60-day ultimatum for conclusion. With today being June 1, 2025, there are just 9 days left until that deadline. The U.S. has even threatened to bomb Iran's nuclear facilities if diplomacy fails, according to BBC.com. Israel reacted swiftly. Prime Minister Benjamin Netanyahu's office called the report a, quote, clear warning sign, end quote, that Iran is, quote, totally determined to complete its nuclear weapons program, end quote, adding 60% enrichment has, quote, no civilian justification whatsoever, end quote, as reported by Yahoo News and the Arizona Daily Star.
Strong words from both Washington and Jerusalem. How has Iran responded to these damning IAEA reports and the escalating international pressure?
Iran's foreign ministry expressed fury, Grace, calling the report, quote, biased, unprofessional, end quote, and based on, quote, unreliable and differing information sources, end quote, according to the Arizona Daily Star. Iran maintains its nuclear program is for peaceful purposes, citing a religious decree against nuclear weapons. Iranian officials have also accused the IAEA of overlooking the U.S.'s 2018 withdrawal, which Iran says is the root cause of its actions. While Iran generally maintains peaceful intentions, Iranian officials have increasingly suggested the possibility of pursuing an atomic bomb, as noted by Yahoo News.
So, a standoff. Ethan, Iran claims its 60% enriched uranium is for civilian purposes. Is there any truth to that? And how quickly could they produce a weapon from their current stockpile?
Grace, the IAEA and several Western nations state there is no credible civilian justification for enrichment at this high level. However, Iran maintains its 60% enriched uranium is for molybdenum-99, a medical isotope. Indeed, IAEA reports confirm Iran has used a portion for this, as reported by appnews.com and iranwire.com. But there's a global effort to convert such production to use low-enriched uranium to mitigate proliferation risks. As for weaponization, experts estimate Iran would need about a week to produce enough weapons-grade uranium for its first nuclear weapon from its current 60% stockpile, according to the Times of Israel and ISIS-online.org. This is because 60% enrichment accomplishes over 90% of the work needed to reach weapons grade. U.S. intelligence assesses Iran has not yet begun a weapons program, but has undertaken activities to position itself to produce a device if it chooses, as reported by Yahoo News.
Thank you, Ethan, for that incredibly detailed and sobering report. It truly puts the scale of this international concern into perspective. We appreciate your breaking down what these reports mean for global security. This is certainly a story we will continue to follow very closely. Welcome back, everyone. We turn now to a story that's truly impacting the health of our nation. As our public health system grapples with a crisis of unprecedented funding cuts, it feels like we're playing a dangerous game of health roulette. Joining us this morning to break down what's happening and what it means for everyday Americans is our health reporter, Chloe. Chloe, this sounds like a serious situation, particularly with what the Associated Press and U.S. News and World Report has described as a boom and bust cycle of public health funding. Tell us more.
Grace, it absolutely is serious. The Associated Press has reported that our public health infrastructure is now brittle and vulnerable. This precarious situation, as of June 1, 2025, stems from a long-standing pattern where public health gets temporary boosts during emergencies, only to be severely underfunded afterwards. It's a chronic issue, but it has been drastically exacerbated by recent actions from the Trump administration, under the leadership of Health Secretary Robert F. Kennedy Jr.
Secretary Kennedy Jr., of course. He was sworn into his role in February 2025 after a very narrow Senate confirmation, confirmed by sources including bbc.co.uk, apenews.com, and npr.org. So what exactly have these recent cuts entailed? What's the magnitude of the impact we are talking about?
The magnitude is truly staggering, Grace. In March 2025, the Trump administration, with Kennedy as health secretary, implemented sweeping cuts. They pulled $11 billion in direct federal support from state and local health departments. The Associated Press reported these reductions came without warning and terminated vital COVID-era grants that were also being used for non-COVID-related public health work, things like vaccination efforts and disease detection.
$11 billion is a massive sum. How quickly did we see the impact of these cuts on the workforce?
Very quickly, Grace. Just a week after those initial funding cuts, around late March or early April 2025, an estimated 20,000 jobs were eliminated at national health agencies. This included significant reductions at the Centers for Disease Control and Prevention, or CDC, as documented by appnews.com and outlets like startribune.com. Public health leaders, cited by the Associated Press, have called these cuts unprecedented. The administration is even proposing billions more in future budget reductions for the CDC.
That's a lot of jobs to lose in such a critical sector. How is the administration justifying these drastic measures, especially with the ongoing health threats?
Well, Andrew Nixon, a spokesman for Secretary Kennedy, defended the administration's actions. He stated that the cuts are about, quote, reforming broken systems and, quote, centralizing programs, with the assertion that the pandemic is over. He emphasized the administration's belief that America remains unhealthy compared to other developed nations, and that HHS is, quote, reorganizing broken systems and reprioritizing resources to centralize programs and functions that will improve our service to the American people, according to appnews.com.
So, they're framing it as a necessary restructuring. But what are public health experts saying in response?
They vehemently counter this narrative, Grace. Public health leaders are warning that these cuts are causing, quote, severe budget uncertainty and, quote, chaos. They argue it's directly, quote, hollowing out, quote, state and local health departments responsible for essential services, and that it's already, quote, putting lives at risk, as reported by the Associated Press. They stress these funding reductions are targeting critical areas like epidemiology, laboratory capacity, and immunizations. It's like draining the pool to fix a leaky faucet, but the faucet is the whole plumbing system.
That's a powerful analogy. Can you give us some concrete examples of how these cuts are impacting everyday public health services at the local level?
Certainly, the consequences are far-reaching. In Mecklenburg County, North Carolina, for instance, 11 community health workers and all 8 employees from their mobile vaccine program were laid off. They also lost a critical wastewater monitoring partnership, contributing to the department's loss of 180 employees as COVID funds dried up, as highlighted by the Associated Press. In North Carolina broadly, $100 million in cuts led to over 80 job losses, severely impacting immunization efforts and disease monitoring, according to appnews.com reporting shared on Reddit.
That's a stark picture. Are we seeing immediate health consequences from these cuts?
We are, Grace. A grave example is the ongoing measles outbreak in Ohio. Specialists confronting this outbreak were laid off, leaving the Columbus Health Department at a mere 25% capacity for disease tracing. The nation is grappling with its deadliest measles outbreak since at least the 1990s, with over 1,000 confirmed cases reported across 31 jurisdictions as of mid to late May 2025, primarily affecting unvaccinated individuals, as reported by ApeNews.com and WFMJ.com. The impacts are already being felt.
That is truly concerning. What about other areas of the country?
In Nashville, the city was forced to end a program offering free flu and COVID tests and cancel plans for a much-needed vaccination van, according to the Associated Press. In Kansas City, Missouri, due to a $500,000 equipment cut, they can no longer conduct their own infectious disease testing, impacting their ability to quickly identify and respond to threats. And the CDC itself has eliminated specific teams working on early intervention for deaf and hard of hearing children, state tobacco hotlines, and drowning prevention, as detailed by the Associated Press.
It seems like no stone is left unturned in these cuts. What are the broader consequences and potential future threats public health leaders are warning about?
Experts fear these cuts leave the nation dangerously vulnerable. Beyond measles, rising whooping cough cases are a significant concern, with experts pointing to waning immunity and declining vaccination rates as contributing factors, as cited by appnews.com and npr.org. There's also a substantial risk of bird flu, H5N1, spreading widely among people, a concern heightened because programs critical for detecting new threats, like wastewater monitoring, have been affected. APnews.com underscored that this upheaval within federal health agencies coincides with this critical infectious disease threat. Experts warn that public health departments might be unable to effectively respond to new pandemics, which could lead to, quote, a lot of damage and death, as warned by the Associated Press.
So essentially, we're cutting corners on our health security. What is Secretary Kennedy's broader vision for HHS, and how do these cuts fit into it?
His actions are framed by his, quote, Make America Healthy Again, or MAHA, initiative. This aims to tackle chronic disease, reevaluate food and drug safety, and increase transparency and efficiency within HHS, as documented by BBC.com, NPR.org, and LAtimes.com. His proposed restructuring aims to reduce the number of department divisions from 28 to 15, including creating a new, quote, Administration for a Healthy America, or AHA. He intends to cut nearly a quarter of the HHS workforce, reducing full-time employees from 82,000 to 62,000. This includes thousands of layoffs at agencies like the FDA and CDC.
That's a significant reduction in force. Has the CDC specifically seen a proposed budget cut?
Yes. For the CDC, the proposed FY26 budget includes a significant cut to its discretionary funding to $5.6 billion, representing a 38.9% decrease from FY25 enacted levels. The CDC is expected to cut 2,400 employees as part of the broader HHS workforce reduction, with reports of layoffs affecting even the Epidemic Intelligence Service, as cited by AJMC.com. Kennedy's HHS has also canceled billions of dollars in public health grants to states and local governments, a move that has faced legal challenges.
It sounds like there's a major philosophical shift happening within HHS. What about the cost-effectiveness of these public health programs that are being cut?
That's a crucial point, Grace. Public health leaders and advocates argue that these cuts are short-sighted and dangerous. The cuts stand in stark contrast to the documented cost-effectiveness of public health measures. For instance, every dollar spent on childhood immunizations is estimated to save $11. Similarly, tobacco cessation programs are estimated to save $2 to $3 for every dollar spent, and asthma control programs yield significant savings, with $70 saved for every dollar invested, as detailed by the Associated Press report shared on LinkedIn.
That's an incredible return on investment. Has Secretary Kennedy's office released any analysis to counter these findings?
As of June 1, 2025, Kennedy's office has not publicly released a specific cost-benefit analysis or economic impact assessment, demonstrating that these extensive cuts will result in long-term fiscal benefits for the U.S. government or healthcare system that outweigh the immediate costs associated with managing resurgent diseases like the ongoing measles outbreak, rising whooping cough cases, and the potential economic disruption from an uncontained bird flu outbreak.
So public health advocates are essentially saying we are penny-wise and pound-foolish, given these potential long-term costs. What are they calling for?
Exactly, Grace. Public health advocates and organizations are urgently calling for adequate, sustained, and flexible funding to modernize public health infrastructure, strengthen the workforce, address health inequities, and effectively respond to ongoing and future health threats. They argue that investing in public health not only improves health outcomes, but also reduces overall healthcare spending and is essential for the nation's health security, according to the Reddit discussion. They believe the cumulative underinvestment threatens to reduce the entire public health system to a shadow of its former self.
Chloe, that's a very comprehensive, albeit concerning, report. It sounds like our public health system is teetering on a critical precipice. Thank you for shedding light on this vital issue.
My pleasure, Grace.
We've been speaking with our health reporter, Chloe, and that reporting drew on information from the Associated Press, U.S. News and World Report, BBC.co.uk, apenews.com, NPR.org, StarTribune.com, Spreaker.com, Reddit, WFMJ.com, LinkedIn, Scadden.com, CBSNews.com, LAtimes.com, FierceHealthcare.com, BioPharmaDive.com, and AJMC.com. Here are some other headlines. Get ready for a slam dunk of a series, folks, as the NBA Finals are officially set. The Oklahoma City Thunder, who had a shockingly good season finishing with the league's best record at 68-14, will host the Indiana Pacers for Game 1 on Thursday, June 5th. This is OKC's first trip to the finals since 2012, largely thanks to their young core. MVP Shai Gilgeous-Alexander, who was also Western Conference Finals MVP, Jalen Williams, and Chet Holmgren. They thundered past the Minnesota Timberwolves in 5 games, clinching with a dominant 124-94 victory. Meanwhile, the Indiana Pacers are making their own fast break to the finals for the first time since 2000, after pacing themselves to a 4-2 series win over the New York Knicks, sealing it 125-108. Pascal Siakam, who brings championship experience, was named Eastern Conference Finals MVP. It's quite the turnaround for the Pacers, who started the season 10-15. Key playmaker Tyrese Haliburton has been instrumental. This series guarantees a new NBA champion for the 7th consecutive year, as neither franchise has won in their current iterations. The Thunder last won as the Seattle Supersonics in 1979, and the Pacers, despite 3 ABA titles, are seeking their first NBA crown. It's a tale of young talent, with the Thunder's average age a mere 24.8 years versus the Pacers' veteran-bolstered squad. Keep an eye on the electrifying point guard matchup between Shai Gilgeous-Alexander, the league's scoring leader, and the highly efficient Tyrese Haliburton. It's also a win for small market success. The 2-2-1-1-1 series will be broadcast on ABC starting June 5th at 8:30 p.m. Eastern, with potential games running through June 22nd. Switching to the soccer pitch, Paris Saint-Germain achieved a historic first on May 31, 2025, absolutely dominating Inter Milan 5-0 to claim their first-ever Champions League trophy. The final, held at Munich's Allianz Arena, saw 19-year-old French sensation Désiré Doué truly doué it all, scoring 2 goals and providing an assist, earning him player of the match. His first was a slick finish from a Vitinha pass, and his second saw him coolly slide the ball past Inter's keeper. Goals also came from Achraf Hakimi, who politely didn't celebrate against his old team Kvaratskhelia, and substitute Seni Mayulu, who scored just 2 minutes after coming on. This victory sealed a treble for Luis Enrique's PSG, a first for any French side, and came in their 168th game in the competition, the longest wait for a first-time winner. This win also qualifies PSG for the 2025 FIFA Intercontinental Cup and the 2029 FIFA Club World Cup, proving their team-focused approach, though still one of the priciest squads, has paid off. Inter Milan were left looking quite overwhelmed. From the pitch to the time vortex, the Doctor Who season finale, Empire of Death, which aired in June 2024, had fans buzzing. In a major twist, Ncuti Gatwa's 15th Doctor regenerated after 2 seasons, and who should appear but Billie Piper, the beloved Rose Tyler. Producers are keeping her new role under wraps, with showrunner Russell T. Davies teasing. Just how and why she is back remains to be seen. The finale saw a showdown with classic villain Sutekh, who'd been sneakily hiding in the TARDIS since 1975, planning to extinguish all universal life by spreading his Susan Triad incarnations. The season-long mystery of Ruby Sunday's parentage was also solved. Her mother, Louise Miller, was an ordinary woman who gave her up as a teen. Ruby reunited with her now 35-year-old mom. The Doctor and Ruby saved the day by tricking Sutekh, attaching him to the TARDIS with an intelligent rope, and dragging him through the time vortex, which ingeniously reversed all the deaths, making death itself die. Ruby decided to stay on Earth, while the Doctor departed alone, promising to return. But watch out, Whovians. Ruby's mysterious neighbor, Mrs. Flood, played by Anita Dobson, ominously promised the Doctor's story would end in, quote, absolute terror, hinting at a major role next season. There's also chatter the Doctor might look up his granddaughter Susan. And now for some crowning news. Opal Suchatatwangsri from Thailand was crowned Miss World 2025 on May 31st in Hyderabad, India, a historic first for her country. The 21-year-old Phuket native, fluent in Thai, English, and Chinese, and currently studying political science, was crowned by Kristina Pishkova. Opal's Opal for Her campaign, focusing on breast health awareness following her own surgery at 16, was her Beauty with a Purpose project. She's quite the talent, playing the ukulele backwards and owning 16 cats and 5 dogs. This victory, at the 72nd edition of the pageant co-hosted by Stephanie Del Valle and Sachin Kumbar, marks the second Southeast Asian win. Miss Ethiopia was first runner-up. Opal, who also won the Voice for Change Silver Award in 2024 and topped the multimedia leaderboard, aims to, quote, make a real difference. Finally, in California, 16-year-old transgender athlete A.B. Hernandez from Jurupa Valley High School made headlines at the CIF State Track and Field Championships on May 31st. Hernandez won gold in the girls' high jump, clearing 5 feet 7 inches, and the girls' triple jump with a leap of 42 feet 2.75 inches. She also secured second in the long jump. Her success sparked national controversy, with critics calling for a ban. In response, the CIF implemented a new rule allowing an additional cisgender student to medal in events Hernandez qualified for, meaning she shared her podium spots. Despite the pressure and protests, Hernandez remained focused. The situation has highlighted California's 2013 law on gender identity in sports, which is now under a Department of Justice investigation. That's all we have for now. Today's episode was made by Alexander King with Claude Sonnet 4.0, Gemini Pro 2.5, Gemini Flash 2.5, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.